Hey guys, good evening. It's Dr. Lauren here, and I'm super excited to visit with you tonight about Torticollis, head shapes, and helmets for our little ones. So here's the thing. I have had an influx of patients in our office lately who are dealing with these types of challenges. We had a 3-week-old little baby who came in this week with these types of things going on. And we also had several parents last week experiencing the same thing with their babies. So anytime that I see a trend in the things that are showing up in our office, I know it's something that I really need to chat with everyone about to make sure that everybody has the same information about their little one, their health and wellness, and then really how you can help your child through this phase of development that can really be challenging. So first off, I want to share a little bit about myself so you kind of know the background of where I'm coming from with this information. And then also I want to share with you first, how does this develop in our children? Why? What you can do about it to prevent it, and then what you can do about it if you've already kind of started down this path of uncertainty. So first off, my name, as I mentioned, is Dr. Lauren Alvarado. I am a pediatric and family chiropractor here in Arlington, Texas. We see everything from newborns, well, let's even backtrack to pre-fertility, fertility, pregnancy, newborns, moms, postpartum, and whole families. So, but I have a huge heart for the newborn phase because of one major reason. I was a mother that struggled big time during that phase with my first baby in particular. We had, and I'm going to get into a little bit more details on this in a minute and why our stories might be very similar, but we had a challenging birth experience. She wasn't in the best position. I pushed for 3.5 hours. And I ended up having to have a C-section. So she had some of the challenges that I'm about to share with you. So I've been down this path, and I know how hard it is emotionally, physically, and also just like energetically, and then how emotional it can be when you're looking for answers for your little one and you're kind of hitting a brick wall. I have moms in my practice every day who tell me, you know, they were concerned about XYZ with their kid and they went to another specialist or a family doctor, and they didn't really get any answers on head shape except for helmets. Or on baby having a preference on one side or the other, except that can be normal. So I've heard some crazy things in regards to all of this. I'm going to share some of those stories with you, and I'm here to help you get on the other side of it or prevent it. So let's get started. So first off, let's tackle torticollis. Torticollis is whenever there is tightness in one of the actual muscles in the neck that causes a lateral tilt and rotation in the neck. Now, that tightness doesn't just come from the soft tissue being tight, okay, which is the ligaments, tendons, muscles, okay? We really have to think about, so sometimes when we're dealing with providers, they may really look at the soft tissue issue, okay? But it's important to know what controls soft tissue. Your nervous system, okay? Your baby's nervous system. So what controls the tightness and tone of that muscle in the neck is actually a nerve that comes and innervates that muscle to tell it to actually contract or relax. So the nerve runs the show. So in torticollis, we can see babies that have a lateral tilt and rotation. And it's because the nerves in their neck that communicate with that muscle are not working quite right. And so it's creating that asymmetry. Now, how do we even get into this head shape conversation that comes next? If you've had a baby with torticollis, or you currently are questioning your baby's posture, then just know that changes in head shape come next, and I'll let you know why in just a second. But what I really want you to do is that maybe you've got some concerns with your little one right now. Some early signs of challenges like this can be difficulty sitting in their car seat because they're super uncomfortable. So super fussy. That happened with my little girl. She literally cried in her car seat for the first 3 months, and I wasn't really sure why. The second thing is noticing that they may prefer one breast over the other. They may prefer one sleeping position over the other. They may always have their head turned to the left or right, and when you turn it to the other side, it might stay for a minute, but it's going to go right back. You may notice that they just have some abnormal tension in their spine with a little bit of rotation. You might not notice the rotation. Another common thing that parents complain about is that their child seems to be uncomfortable and is extending their back and their neck and their head and kind of throwing themselves backwards, that can be a very common first sign of stress in the nervous system and in the neck. And again, the difficulty sleeping, difficulty resting and digesting is a number one sign as well. So just know that torticollis is that, little changes in posture of the head, but it does actually coincide with all those other things we just talked about, and sometimes even a few more, like ear infections and things like that. So if you have any concerns about your little one in any of those departments, it's really super important to have them checked by a pediatric chiropractor that can actually find and locate the challenge and then help troubleshoot it with you. So second thing, where does this head shape thing come from? So if your little one has asymmetry, a lack of nice symmetry in their head, or maybe you have seen babies with little helmets, then you know what I'm talking about. If you haven't seen that, then I'm just going to explain a little bit of it and then really just how to prevent it and then what to do if you're already in the thick of that situation. So with little ones, whenever they're sleeping, so babies aren't sitting up and aren't walking around, right? Their primary position is going to be laying down, okay? Now, you can put them in carriers, you can hold them all day, but this myth about, you laid your baby down too much isn't necessarily true. So I want to debunk that. It can be, but I don't know anybody that lets their baby lay down for like 18 hours a day or something, right? Like, you're holding your baby, you're cuddling your baby, everybody's helping with the baby, right? Like, people are holding the baby. Because babies won't let you not really hold them because they squawk at you, right? Or they cry. They want to be held. They want that affection. So for the most part, the whole, my baby had a flat head because we laid him down too much isn't typically true, okay? Now, the reason why the head gets flat is that when they are laying down, whenever there's too much pressure on the cranial bones, which at this stage of the game are tiny little bones that form the skull, and they're not fused together. So many of us might think that that little baby skull is totally solid and fused together, but that's not the case. Imagine a skull, even your own, just like Earth, where we have these continents, they all come together with a little line, right? They all kind of butt up against each other and they can move and shift. Same thing with our head actually, and it's for a reason. Our cranial bones flex and extend, which you can't see that or feel that. But just like you can't see or feel your heart beating for the most part, we can't see or feel that. So as the cranial bones flex and extend with each other, they do it with our breath as we inhale and exhale. And the whole point of that is for it to pump our cerebral spinal fluid, our fluid that bathes our brain and our spinal cord, to pump that through the body and through the nervous system and keep it healthy, okay? So these little bones have a purpose and should be moving other than just protecting our brain, okay? But when you're laying down, just imagine as an adult, when you're sleeping and you get uncomfortable, you should be able to move into a new position, right? In order to get pressure off of your hip, off of your shoulder, or off of your skull or face, or however you're sleeping. But with newborns, they can't roll over yet, right? So really all they can do if they're sleeping on their back is turn their head from left to right. So let's kind of dig into why they wouldn't be able to turn their head from left to right, and why would they have more pressure on one side of the skull than the other. So what turns the head, okay? Does the head turn the head? What turns the head? The neck turns the head, right? So this is a little spine here, kind of like a toddler size maybe. But what turns the head is, yes, the base of the skull does turn the head, but what does it turn it on? The neck. And then the neck, actually, most of the rotation in our neck comes from the top vertebra, where we can turn our neck to either side, right? So this is the back of the head, the base of the skull. So most of the time, babies that do have flattening will have it on one side than the other. And sometimes if it goes on long enough and is significant enough, it can be the entire head. So what turns the head to get pressure off the head while a baby is sleeping so they can go from left to right? It is primarily this mechanism between the base of the head and the first vertebra here. So they should be able to turn when too much pressure is on one side and go to the other side. But what happens is they can lose range of motion if they don't have good range of motion in the top of their neck, then they can't do that, okay? So when they can't turn their head and they can't get pressure off the base of their head, because let's say the nerves that are exiting the neck right here that go to these muscles are tightening those muscles down and rotating it, so they're gonna constantly lay on one side predominantly, or it might not even be as much of a subsequent soft tissue issue, but maybe mainly not lots of spasm, not lots of change in the posture of the head, but still you can have plenty of rotation in the top of the neck to where they are laying primarily on one side. So this baby here, if we've got lots of rotation here, would be laying primarily on the left side of the occiput, going the other way, right side of the occiput, okay? So with this, whenever we have changes in the range of motion in the top of the neck and in the base of the skull, it can make it to where we get an abnormal amount of pressure on one side or both sides of the skull because the baby cannot move in the night or when they are laying down. So with that, that's why we have, whenever we have changes in soft tissue or alignment, we start to see changes in the shape of the head. Because those cranial bones are still movable, and sustained pressure on them will actually influence them in that direction, okay? So helmets, let's talk about helmets. Helmets are the typical approach to changes in head shape, okay? Helmets are sometimes considered just cosmetic, but they're not really cosmetic because honestly, we do need to have really good shape of those cranial bones so that they don't put added pressure on a growing and developing brain. So if we have added pressure on a growing and developing brain during where a child's nervous system and brain and spinal cord is still truly developing, then we can have changes in things like milestones, ability to roll over, sit up, swallow, ability to develop normal speech, normal walking patterns, normal ability to have good balance and coordination, crawling, all these little milestones in no particular order that I just mentioned that we have to meet. When we have changes in the upper cervical spine and the actual shape of the skull around the brain, it can change the way the brain is growing and developing. So helmets are not just cosmetic, although none of us really want our child to have a flat head, and it's an added benefit that it won't look flat anymore. But let me ask you this, having understood the mechanism of torticollis and what we call plagiocephaly or brachiocephaly and flattening of the head, understanding the underlying cause of that, how is a helmet helpful? Well, the helmet does change the shape of the skull, but what it doesn't do is actually improve the motion of each individual cranial bone within the skull, okay? It's just forcing it into position, but it's not making sure they're flexing and extending over each other like it should in order to pump that CSF. So yes, cosmetic, and yes, changing the shape of the head, but not necessarily changing the function of the cranial bones. What other benefits do we have to a helmet? Well, mainly the cosmetic benefit and the pressure off of the brain in the area that may be being compressed. But is it actually solving the underlying cause of the change in the shape of the head? It's like the chicken before the egg. We can't just fix the actual symptom of it and not actually fix the cause of it, right? So what we need to do is really understand that it's not the chicken before the egg, it's the egg before the chicken, right? In this scenario, like when we're looking at this. So we need to really understand that the change in the shape of the baby's head is not just because they're laying down on their head, and it's actually because their neck is not moving like it should. They don't have normal range of motion. And I said that backwards. Chicken before the egg. There we go. Whatever. Y'all understand what I mean, right? So what we do is actually address and check the range of motion in the top of the cervical spine and in the cranial bones and the positioning there. How does that actually change in our kiddos? Like, why would a child have a misaligned spine? Well, number one cause has to do with their actual pregnancy experience and birth experience. So oftentimes babies can be in funky positions in utero. They can be breached, they can be transverse, They can be OP or occiput posterior, like my daughter who is sunny side up. So every time I push, she went into extension. So that can cause a lot of stress to the upper cervical spine. There could be a C-section, vacuum extraction, forceps used, or babies could just have a little asynclitic or head tilt that with contractions caused extra stress in the upper cervical spine, causing it to lose its optimal position and its range of motion. So most of the time, this actually starts in utero before you go into labor, and then labor is like the end effect on the cervical spine, because as the baby is coming through the birth canal, whether there's intervention involved, like I mentioned, or there's just head tilt that's happening that's really unpronounced to us, like, you don't know what's happening down there when that's going on, then that can change the alignment of your little one's neck and therefore really set them up to not have good range of motion, to not be able to turn their neck and get pressure off of their head. So what we need to know is that, yes, helmets can be helpful, and there's always a time and the place. So I'm not anti-helmet, I'm not anti-medicine or anything like that. But I always know that it's super important, even if we needed medicine, even if we needed helmets, even if we needed surgery of whatever kind, to help correct something, it is very, very important to actually look at the original cause of it so that we can make sure two things. Number one, that we take care of the original cause. Number two, that we get in front of any challenges that could be down the road if we don't. So for instance, I mentioned earlier that children that have stress in the top of their neck can actually be set up for other struggles. So meeting those milestones. We specialize in neurodevelopment in our office, so we see kids from all ranges of ADHD, autism, Asperger's, all these things, children who just have anxiety and sensory challenges. And one of the most common findings in their history is some type of history of birth trauma, typically issues with latching, turning their head from one side to another, and also flattening of the head. So just know that getting ahead of these things can set your child up for optimal neurological development and brain development, and also make sure that you're just setting them up for success in their growth and development and later in life too, right? So I wanted to share this information with you because we've had so many cases like this coming in lately, and mothers are actually, letting their girlfriends know, hey, this is what was going on with my baby. I heard you mention colic with your baby and their head shape and nursing issues. So you need to go in and get help too. And so we've just seen it influx in those patients. The little one that was in our office this week was actually a dad, which I love that, a dad of an existing patient, called up the other dad and was like, hey dude, I know that your baby was struggling after birth and is having some tummy issues, some postural issues with their head and neck. And I talked to this doctor and she shared with us how she could help our son. So I think you should go see her. So absolutely loved visiting with this family. It's one of my favorite things to help parents really transition into that, what they call fourth trimester, that phase of parenthood right after birth, where just sometimes, especially with first babies, things are happening that don't really make sense. In your mommy gut that something's not quite right with your baby, but you just don't know where to go. You don't know what to do. You've looked up on Google, you're in the Facebook mom groups, everybody has an opinion, and you just don't know what's right or wrong just for your family. So I want to be a resource to you. If you have questions, if you've noticed any of this in your little one, if your baby's been through a helmet and you want to make sure that, yes, you took care of the head shape, but let's get to the root cause of it to set them up for success, then I'm here for you. So reach out, message me on this video, message me on Instagram or wherever, or call the office and visit with my amazing team so that we can help you and your little ones too. So I hope this was super helpful, and I'm excited to hear your questions and find out how I can help you. Y'all have a wonderful evening, and I will see you next Tuesday for Milestones Matter. So we'll be getting into our next webinar, which is really about those milestones and why they're so important, the sitting up, crawling, walking, all that stuff, and then how that, if your little one has struggled with milestones, what you can do to get them back on track. So I look forward to seeing you next Tuesday. Bye.